Here we discuss about these issues, we provide solutions to some of these issues that we get to face in our country. And today's a topic is of no exception, okay? Because this is definitely what is affecting a lot of our adolescents, a lot of young people. All right, so that is why we are bringing it today, and we just had to do the big question today to talk about this. So yes, of course, this is Women Radio WFM 91.7, Nigeria's first radio station for women and their families. So today we'll be looking at innovating for equity. Okay, bridging gaps in SRHR access for adolescents and young people. Don't worry, you get to understand what SRHR is all about. All right, so that's what we're talking about today, and we have two amazing women with me in the studio, and we're going to be talking about this. But just before that, okay, let me just give you, a background to what we're talking about today, and so that we're all carried along and we have a perfect understanding of, why we are talking about this today. So, like I said, today we're looking at innovating for equity, bridging gaps in SRHR access for adolescents and young people. Now, in recent years, the importance of prioritizing sexual and reproductive health and rights, SRHR, so that's sexual and reproductive health and rights. Now, among adolescents and young people has gained significant attention worldwide. This is particularly crucial in regions like Southwest Nigeria, where there are unique socio-cultural dynamics and challenges regarding SRHR. So for the purpose of this conversation, we're going to be mentioning SRHR a lot. And when we say SRHR, we mean sexual and reproductive health and rights. Okay, so just have that at the back of your mind. Now, early pregnancy among adolescents increases the risk of complications for both the mother and her baby, and in some cases leads to their death. Now, according to Nigeria, MICS report, MICS report, 2022 report, 21.1% of women aged 20 to 24 have had a live birth before the age of 18, and 11.3% of women aged 15 to 19 have had a live birth or are pregnant with their first child. Now, UNICEF 2019 reported that 510,000 young people between the ages of 10 and 24 were newly infected with HIV, of whom 190,000 were adolescents between the ages of 10 and 19 years. Now, this is definitely alarming. Now, adolescents and young persons, that's AYPs. Now, for the purpose of this conversation today, adolescent and young persons, we will be, calling them AYPs. So that's the abbreviation. So we have SRHR and then we have AYPs. That's adolescent and young persons. These adolescent and young persons are also at risk to other SRH issues, such as unsafe abortion, we're looking at sexual coercion and violence. Now, these issues are exacerbated by unhealthy sexual behaviors, limited access to why am I always putting H before R? SRH information and services, poor utilization of SRH services, negative perception of SRH services. So that's sexual and reproductive health services, and unequal power relations and gender norms. Now, sexual and reproductive health and rights, SRHR, encompass a range of health issues including family planning, maternal health, HIV and AIDS prevention, and safe abortion. All right, so all of this today, that's just to give us a quick background of why we are looking at innovating for equity, bridging gaps in SRHR access for adolescents and young people. So we've given you the reasons why we are looking at, sexual and reproductive health and rights for adolescents and young people. Now, the SRHR Impact Plus project aims to empower youth-led civil society organizations with essential tools and skills and amplify the efforts of SRHR champions, all right, and their interventions. Now, through community engagement and strategic media campaigns, the AYPs, that's the adolescent and young persons, will gain enhanced access to comprehensive sexual and reproductive health and rights information that will lead to informed decisions and reduce high-risk behaviors. The ultimate goal is to decrease unintended pregnancies, decrease HIVs and STIs among young adults, okay? That's what we're looking at today. So adolescents and young persons. Now, this could go ahead and foster sustainable SRHR progress through strengthened advocacy capacities of CSOs. To address this gap, several youth-led, youth-focused and emerging non-governmental organizations, CBOs, that's community-based organizations, will be working with HACI across the country to provide AYPs with information and services to SRHR. All right, so this project is implemented across Lagos, Osun, Ondo, Ekiti, and Oyo. All right, and this actually brings together stakeholders, including government agencies, to build a sustainable movement for positive SRHR. All right, so all of this we'll be talking about today, and of course we'll just go straight to meet our guests for today, and of course we'll get to talk about this because both of them are here to talk more on this particular topic. And they're amazing women doing well in their different fields this afternoon. All right, this is 14 minutes after 12, and this is Women Radio WFM 91.7. So first off, I have Simi Lolua Awe. She is a lawyer and a youth development practitioner with 8 years of professional excellence, purpose fulfillment, and passion accomplishment. She's the founder of Hey Teens and Twenties and a multi-award winner to attest to her all-round impact in making the global goal tagged Agenda 2030 achievable. She has a background in law with a key interest in medical law and ethics. All right. Simi Lolua, let me just give you shekere because you deserve it. You're welcome. Good afternoon. Thank you so much for joining us today, and we can't wait to hear all you have to tell us about our young people, our adolescents who are facing all of these challenges, and sexual health, reproductive health is something that has always been in our faces. So sometimes the young ones don't even know what to do. They don't know the right questions to ask. They don't know the right places to go to. So all of this, I'm pretty excited that we're talking about this today on this program. So next up, I have, first of all, let me just say forgive me, because I know you have mentioned this name like 3 times. Well, let me just say forgive me first. Okay, so next up I have Anu Oluwapo Owosheni. Yeah? I hope I got that. Did I try?
I tried.
Okay, thank you. Good afternoon. Thank you so much for coming on the program. So for the purpose of this conversation, can I just call you Anu? Is that okay?
Of course.
Okay, great. So she is here. She's a public health student at the University of the People. She's passionate and unapologetic feminist. Okay, with over 6 years of experience in sexual and reproductive health. Take shekere. All right, so and over 6 years of experience in sexual and reproductive health, she designs inclusive programs to ensure every person, especially underserved communities, women and girls and youth, have access to quality sexual health care they need. She also creates sex education programs, facilitate workshops, and collaborates with organizations to fight health equity and empower individuals to reach their full potential. I must say, both of you are doing amazing in your fields, and I'm so excited to have both of you in the studio. Please just come closer to the mic so we get to hear you well. All right, so let's head on straight to the conversation today. This is Women Radio WFM 91.7. My name is Rose Yusuf Kaiser, and of course today we are looking at something really important that has to do with our adolescents and young ones. We're looking at innovating for equity, bridging gaps in SRHR access for adolescents and young people. And if you're just joining us, SRHR means sexual and reproductive health and rights. Okay, so we're specifically looking at adolescents and young people this afternoon. So let's head on straight to my very first question. Now, despite progress, in Nigeria, SRHR landscape and many AYPs, that's adolescent and young people, particularly from rural or marginalized communities, still lack access to comprehensive youth-friendly SRHR services. Now, what policy reforms can be made to ensure equitable access for all Nigerians, adolescents and young people, including those in underserved regions? Because when you look at Nigeria as a whole, the underserved regions, are much more. You can actually just point them out and say, this particular part of the country is, underserved or is marginalized, or they're not communities that we get to hear of every day. And some of these things happen, in a very large scale. So let's hear from you. So.
Okay, thank you very much. It is very, very important because when we talk about sexual and reproductive health and right, we talk about young people as a whole, not within a particular region, but we realize that people in urban areas like Lagos have more access to opportunities, like when we talk about the one-stop centers at various areas, youth-friendly centers like Elo Lagos and all of that. We realize that in this rural area where there is more pertinent case of teenage pregnancy, they are the ones who still have to rely on health centers that they don't really even have the knowledge of what these health centers can provide for them. Like, these health centers are not even sufficient to do this. So it's just a case of we now telling everyone to let's gather together to kind of decentralize healthcare funding so that we can reach out to these rural communities, so that we can strengthen youth-friendly centers in communities like the rural area, whereby they can also have opportunities to healthcare facilities in our community like the ones we have in urban areas. Let's kind of take the information, the knowledge, the innovations that we currently have, which is actually trying to address these issues. Let's take it to those areas where this is actually happening. So with strengthening youth-friendly centers in rural area and also decentralizing healthcare funds, we'll be able to reach out to this target audience, and we should also inculcate policy reforms that try to encourage community engagement so that we can reach the target audience, the main people who are victims of this, because there is no way we talk about Nigeria, we talk about data, and we don't involve these people in the rural area. So it is very important that in anything we are doing, we should consider them first, because it seems like all the attention now is on the urban areas, like the cities and everyone in the cities and all of that. So we need to take it back home. There is a lot of innovations that can actually serve this underserved community. Now we need to come about policies that ensure that we have equality at various sectors.
I definitely agree with you on that, because you're talking and I'm just imagining my village, Kaduna State. Honestly, I'm just imagining my village in Kaduna State, because every day you see young children. I mean, this year you go to the village, you're saying, oh, this 13-year-old girl. The next 2 years, you're going and you're hearing that she done born one already.
And she's pregnant with this.
Thank you. So I'm just looking at my village, and then I'm trying to also imagine what is happening in so many rural communities. Now, me here, in Ogun State, I might know better. I might be able to tell my neighbor's daughter, that's okay, you're getting older, you're young. Have you thought about this? Have you thought about how to protect yourself? Have you thought about all of this? There are places I could take you to have the best care, and all of that. But people in my village, young girls in my village, might not necessarily have all of this information. So which is why I definitely agree with you on, taking this back to the grassroots. All right. So now, this takes me to my second question. Now, given that Nigeria's diverse socio-cultural context, what strategies do you think that we can actually employ to overcome cultural and religious barriers that hinder adolescents and young people's access to these services? And the services we're talking about is sexual reproductive health, services here, especially in more conservative areas. How do we go about this?
Okay, I think I can speak to that. So there's this initiative that we carry out at Vision Spring Initiatives. So when it comes to sensitive interventions like maybe safe abortion, having access to SRHR by young people, we ensure that we call these gatekeepers. We call them gatekeepers because without them, we won't have direct access to these adolescent and young persons that we want to actually reach out to. So we call them gatekeepers, who are the community leaders, the religious leaders, the ballets, the imams, the pastors. We call them together and have like a VCAT training. We call it the value clarification and attitude transformation training, because we believe that most of our beliefs, most of our biases, they were passed on to us. Most of them were hereditary. We didn't like actually say, oh, this is what I believe in.
Exactly.
Because actually, I'm speaking from experience. When I got to a space, I was like, oh, so this is how this thing is. When you get to hear the story from the horse mouth, then you tend to believe, oh, this is this actual situation. But what I've been like believing in, what I've trusted in, what I've built my value around before were just hearsays from my parents, from their parents, which has been passed across. So we let them know that most of your values that you have, they are not actually yours, and now you have to like clarify them. You have to understand, are these things what I still believe in? They will let them know that even though when it comes to bias and when it comes to adolescent and young people having access to SRHR, you have to make sure that your biases are not in the way. Because if we are talking about values, if we are talking about norms at the mercies of other people, that means it ought not to be in existence in the first place. Because what you believe in that is costing other people's their health, their lives, shouldn't actually like be taken into consideration. So that is why we ensure that we carry out this VCAT training for them to clear their values, and we also do this for healthcare workers as well. Because of course we know that we can access sexual and reproductive health care in the hospital, but I having that confidence of going there without me being discriminated against exactly is another thing entirely. So I know that I can go to the hospital to request for this particular service. But what about other adolescents and young people that do not even have this idea at all? They don't even know when they can go to the hospital. They don't know that they can go to the hospital to seek some services. Even at this my age, I can't walk into the hospital and say, please, can you give me a condom? They will look at you in another way. But maybe when it's a guy, it's going to be a different case. But when it comes to us, oh my God, have you started having sex? That is the first question. But me thinking about that in the first place makes me, oh, I don't want to go there. Let me just maybe reach out to a pharmacist, maybe go to a chemist and just seek these services, since those people are not going to be asking me these questions. You know, it's so terrible to the fact that young girls, they find it difficult to say they want to buy menstrual pad. You know, when you want to buy menstrual pad, you say maybe when people are there, you just tend to use codes, or you let them go. Then you say, I want to buy menstrual pad. I used to be like that. I used to buy some nylon, wrap it around the throat and start running, because I believe it's something I have to keep secret. I have to like, nobody should know about it because it makes me dirty. And that is what I've been like gotten to know. That is what I've been told, that this is how this thing is. But getting acquainted with sexual and reproductive health and right education, I knew about this, and I know I was like, no, I can't do this anymore. Whenever I want to buy a pad, I say it on the top of my voice. Oh, I want to buy this particular. And no woman was like, aren't you ashamed? I said, aren't I ashamed of being who I am? I can give birth to you. If your mom was ashamed, would she have given birth to you? And I was like, oh my God, that's true. So if we take this thing to what people can relate to it, they will actually understand what we are talking about.
Yeah. So this actually brought one experience to mind, and I think a lot of us were actually shy at some point to get sanitary pads. But now, I can walk into any store, look for the brand I want. I will carry it. If you like, look. If you like, don't look. It concerns you. Because last, you get sister for us with the drum.
Exactly.
You get mama with the drum. And because you want the drum, that's why they born yourself. So why should I be ashamed of what I don't even have control over? Because I didn't choose to come to earth to be a woman. I just saw myself as being a woman. I mean, this is what it comes with. I will carry it gently on my head with all pride, and make it, because at the end of the day, you're also, some other young girls are looking at you while buying that, and you're able to take that up from you. Alright, this is 27 minutes after 12 right here on Women Radio WFM 91.7, and of course we're having an amazing conversations as regards sexual reproductive health rights this afternoon on The Big Question, and I have two amazing women with me, and we have been discussing this, especially as it regards to accessing these services in marginalized communities, in rural communities, because whether we like it or not, we come from a village, and when you go to that village, some of the things
They do not.
They don't know. And because you know these things, they have helped you to make better decisions for your life. Meanwhile, they that are there, they don't know any better. And even if they know, maybe not exactly what it is. Yes. They just know it as something passing, passive, but they wouldn't really know it. So let's come back to, the technology aspect of this. Now, with Nigerians increasing digital connectivity, how can mobile health technologies, telemedicine, and digital platforms be integrated into the existing SRHR framework to reach adolescents and young people in remote and underserved areas more effectively? Let's not forget that even where we are, we still deal with a lot of network problems. Yes. And then it's not even everybody that is even open to telemedicine. Yes. It's not everybody that is open to digital platforms. And we know how maybe it can be a little bit expensive to own a mobile device. Talking of to access all of these, tools, or what do you call it right now? All of this, I've forgotten the name, but just to have all of the applications in your phone. So let's even imagine people in the rural areas now with all of this. How are they even able to access this? Because if I cannot go and face a nurse, or if I cannot go to hospital to go and tell a nurse, please, I've been having unprotected, sex, and I would want to protect myself better. Guide me through. What are my options? If I cannot go and meet a nurse, eye to eye, and sit down and tell her because I'm not bold enough, I should be able to go to my phone now, enter any telemedicine application or, digital platform, ask these questions, and I will get the answers I need without even having to face anybody. But they over there can't actually do that. So, what do we do, or where can we go from here?
Okay, thank you. Honestly, when we talk about adolescent and young persons in rural area, there are a lot of challenges. Data is expensive. The fact that, there's just this very wide margin, considering rural and urbanization in Nigeria. When you go to your village, you know the kind of work people do, rely on salary, people go to farm, the amount of money they have access to and all of that, like they can't even afford data properly. It shows that even if you have all these telemedicine, or you can actually access health services online, it shows the disparity. Now let's see how we can bring this in. Although we can't rule out that there are some people in these rural areas that also have access to, we can try to push this to those people and find a way to also try to inculcate this or help other young people who don't have access to internet through SMS services. There's one SMS service that when you send the code, they respond and all of that. These all these chat bots that you can do through SMS. So promoting that SMS service, even if you have a touchlight phone, you can be able to access these health services. You can type, maybe when you respond, hello, I want to seek health services, they can respond with, okay, if you want to seek HIV services, you can press one. All those kind of things. Everybody that has a phone can actually have access to all those things. It's like something, or when you want to buy data, is as seamless as that. So in rural area, that will really help. That SMS engagement kind of setting for like a telemedicine innovation will really help in rural communities. Then the e-pharmacy too. A lot of people don't want to walk into stores to go and buy or maybe prep pre-exposure prophylaxis drug that prevent them from having HIV. If you have somewhere you can order it online and people get this information, that is why it is very important that we engage young people. They are the ones that pass this information around. Like if a young person gets pregnant, before they try to consult the pastor or she has told her friends. Now, if our friends don't know the right information, they will mislead her. So it is very important that we try as much as possible to promote this telemedicine innovation through maybe SMS in rural areas now, even though we have the other facilities available, and we'll also expose them to it. So that is why it is very important that youth engagement is very, very important. Let's have dialogue. Let's talk. We are the ones that are facing these things, and we know the ways through which we feel like, okay, this would be okay. Because I used to say something, in Africa, we really don't need CCTV cameras, because if I'm entering into, maybe there's somewhere where they provide sexual and reproductive health services, and Yabola, our next compound neighbor, sees me, she would tell my mom information we get. That's why it is very important to embrace technology, whereby it is discreet, it is safe. There's this privacy. I can actually access information that I want to access without being discriminated against by anybody seeing me or walking into any store. So it will really go a long long way in trying to bridge this gap.
All right. I like the fact that you mentioned even if it's a touchlight phone, because it's not everybody in rural areas that could actually afford, the big phones that we get to see all over. And that's actually way easier, through text messages. Is it this thing you want to access, press 1? Is it also, medical care you want to access, press so, and that would actually go a long way. All right. Thank you very much, Simi. You want to
Yes,
add
I just want to chip in something.
Yeah.
Okay. It's a very, very good and impactful initiative to say that we can use the SMS method. But the first thing I want to say is, how do they get to know about this initiative? How do they know that it is in existence?
True.
So how do they get to know it? So since they are in the rural communities, we can leverage on radio stations, where they listen to radio. Oh, do you know that this particular initiative has started? You can do this on your phone, or even on your small mobile phone. You can do this, you can do that. So when the information gets to them, they don't know how to take the initiative, because without the knowledge, without the awareness, they cannot take this initiative, and that's it. So
okay, I definitely agree with you, because the information has to go down first of all before they even know what to do.
Yes.
So yes, I definitely agree with you. All right, so now let's look at the involvement of young Nigerians in SRHR policy development and implementation, which is definitely essential for creating youth-centered programs. Now, what mechanism do you think can be introduced to ensure their active participation in policy process? How can Nigerian youth be empowered to advocate for their sexual and reproductive rights? Because now, basically, they wear shoe, I know the picture. So we can't go about making policies and they are not involved, because after making the policies, they will just look and there now. Nothing. If you bring it down to them, they will tell you that this is not what we want, or this is not how we want it to look like. So that is work done zero. So at the end of the day, how do we get to have them actively participate in these policies, especially as regards to their sexual reproductive health rights?
Okay.
Okay, let me quickly chip this in. When it comes to adolescent and young people, there's something that we usually say, it's like a slogan: there is nothing for us without us. Okay, so, excuse me, you said you are making a policy for us. We were not there in the first initial stage, the deliberation, the consultation.
Not
there was
at all.
no young persons, just old men, old women making consultations on our behalf, So there is no way that policy is going to be impactful or achieve its goal. So what I would say is maybe there should be National Youth Committee, where it's focused on sexual and reproductive health and rights, where young people can come together and deliberate on policies before it is being passed into reading and all that. When you consult these young people, it also makes us know that we are recognized. Yes, we are recognized, and our contributions actually count. Because if we are not being included in these processes, then we believe that they are just doing it for themselves.
Of course.
That is why when some parents are telling their kids that I don't want you to do this, but you don't tell us the reason why you don't want us to do that thing, that means you are just doing it based on your own initiative. You are not telling us, this is the reason why I don't want you to do this. It is because it is going to birth this. But because we don't know, we don't have that information, so we believe that it is just for them. And then when we react against that, they call us rebellious, we are doing this, we are going against their rules and that. But when we are engaged in these processes, then it makes it more, it makes more sense.
Yes.
It makes more sense. And at the end, there's not going to be any loophole of, there were no young persons involved in this, or this is not going to be impactful. But when it's throughout the process, young people are involved, then that means everything is going to be key.
Okay, thank you very much. So,
go ahead,
I would also like to chip in something. I think one of the ways to decentralize this, yes, what we are saying, young people should get involved, but in situations whereby there are opportunities for young people to come on board, maybe majorly the ones in urban areas have the opportunities, they see these informations to get involved. How do we decentralize this to ensure that people in rural areas also have access to get involved in this decision making, this policy dialogue? We should kind of have this youth advisory council whereby maybe we have clubs from secondary school, whereby we have representative in each school that talks about sexual and reproductive health, whereby we can empower them with the necessary information and knowledge. Maybe they just talk about it on the assembly, maybe like 10 minutes, maybe on Wednesday on their social gathering, whereby they can also revert. Maybe there's an opportunity for them to write, maybe to the state council, to the local government council, to the community area council, so that everybody at all stages can be involved in this process of making decision, and everybody can contribute so that we can really know what is involved. Then another thing is we should also sponsor youth-led research, because the way my friend will get information from me is not the same way somebody like my mom will get information from me. Because there's a lot of things that comes to my mind when maybe somebody who is in their 50s, 60s is trying to engage me on sexual, considering the moral inclination in the Nigerian system. It is a mixture of morality and the community now. So we are trying to face a lot of things, and there's also religion there. So when I'm looking at somebody who is modestly dressed, I know that this mommy, the pastor, and she's asking me, so are you sexually active? I don't understand what you're saying, because I know that you're about to judge me. So in this kind of setting, we should encourage youth research-based innovations, which will empower them with the resources that is necessary, because without the youth, nothing can be done in getting the AYP. So it is very important that we also prioritize this.
Okay, I definitely hear you. We need to actually prioritize this, because at the end of the day, this is for them. So if you don't involve them, for me, it's just look as if people should just keep talking there. We'll still do what we want to do, because we don't even understand what you're doing in the first place. So if you don't bring us in, then I'm sorry, we can just keep making policies, and then we'll say we're having lots of policies, but there's no implementation. So when it comes to implementation, who did you involve in the first place? And you want to implement something on me? So yes, it definitely has to start from somewhere, and it's by having all of them involved, at least a group that will represent a whole lot involved. All right, so this is about 20 minutes to 1 right here on Women Radio WFM 91.7, and I have amazing women with me in the studio, and today we are looking at a very important topic on the big question. We are looking at innovating for equity, bridging gaps in SRHR access for adolescents and young people, and that's sexual and reproductive health rights. All right, for adolescents and young people, that's AYPs. All right, and with me in the studio this afternoon is Simi Lulua Awe. She is a lawyer and youth development practitioner with about 8 years of professional experience. All right, and I also have Anu Luapo. She's a public health student at the University of People, and she is a passionate and an unapologetic feminist with over 6 years of experience in sexual and reproductive health. All right, so of course, we still have, we will still have a lot of things to actually cover, but we'll see how we can definitely try to manage our time. Well, my name is Rose Yusuf Kaiser, and this is Women Radio. So now we've talked about how to get, youth and young people involved in policy making, especially as regards to sexual and reproductive rights. Now let's look at how the Nigerian government, CSOs, CBOs, NGOs, and all of these private organizations that could actually help to improve the outcome of SRH services. So how do we bring all of these bodies together? How do we bring them to collaborate? Because at the end of the day, we want everybody's hands to be on deck in terms of strengthening, or rather in terms of serving the AYPs better, in terms of helping them make better decisions or informed decisions, particularly in areas with limited government presence, because that's one of the important things about CSO, CBOs and NGOs. They get to places that government cannot necessarily reach, but most times with the help of the government they get there. So how do we bring all of these bodies together?
Okay, thank you very much. I would say that in bridging all those gaps we are talking about, you cannot work in silos, because at the end of the day, nobody's going on with the award of Namidu Pass. That kind of thing. So it is very important. The government will say we are pumping money into these things. The civil society organization are getting grants and they are pumping it towards the same thing. But the thing is, we are not really seeing the result.
effort, yes.
Because the government is also nailing the same, or they are also eating the same nail that civil society organization is trying to nail. So it's just like putting so much effort and resources to address the same problem, but just one fraction of it. Now, what can we do to ensure that the government and the civil society organizations and corporate body get to the grassroots to really make sure that they are doing something really significant, is by having a formalized partnership with government bodies. Okay, the government is saying, okay, we are facing on Ogun State this month. Then the civil society organization will know that, okay, if it's Southwest project we are doing, then we should go and face Ondo State. It's not like everybody keeps going to Ondo, everybody keeps going to Ondo, everybody keeps going to Ondo, and leaving the rest of the community. So this formalized partnership will really help us to break this gap so that the government can have somebody to hold accountable. Then another thing we can also do is to have joint funding initiatives whereby the government can fund private sectors to ensure that we are also making the same, like we are reaching the same goal, but there is a way that the government can make the private sector accountable. You know, there's this thing about, they'll say it's government money, and people in government, sometimes you cannot hold them accountable because it has eaten deep into our system, and that is how things are. It is government money. Yeah. So nobody's going to come and make you accountable. But when the government is giving the money to a private sector, that's when they know that they have the best chance to evaluate and monitor this project to make sure that they're actually using it for the best things they can use it for. So this partnership, partnership would really help us to be able to know where we are going, and the places we have not reached. It will also help us to even collect data. Let's have this conversation. Let's know where we are going, where we have reached, and the places we are going to reach. So the government can support these corporate organizations, civil society organization, empower them. They make sure that they also monitor what they are doing to really help us to move fast.
All right, thank you, Simi. And let's hear you on this one.
Okay, just want to chip in something. According to what she said about joint collaboration, working together. Yeah. So I think, just like what she said, to avoid duplicate efforts, if the government has a plan of reaching maybe like 6 states in this particular month, maybe they were able to reach 3, then you collaborate with NGOs, CBOs, and all these CSOs. Oh, we have reached this particular state. You do not need to go back to that state, because it would be like duplicate efforts. Everybody is channeling everything, their initiatives, their resources into a particular location. So when, and also there is the need for memorandum within government and all these CSOs. We need to sign an agreement to ensure, okay, this is what we are going to do regarding this, and at the end of this is when we are going to track this progress, because we doing initiatives that are not sustainable. There's no way we track. Oh, we said we empowered 5,000 women last year. Have we gone back to check the lives of 5,000 women? Are their lives different? Have things changed for them? Like what we really did, the initiatives, are they really impactful in their lives? Because it is very easy for us to put it in paper and say, yes, the government empowered 5,000 women in Koshofe. Yes, take pictures. It's flying in the newspaper. It's everywhere. Yes, but how can we be confident about what we have done and say, oh, let's go back to what we did? Is it really still working? Is it really still effective? I've known about several government initiatives that were established, but now you can't even talk about them anymore because they are no more functioning. They are no more in existence. But when we started then, everybody was so happy about it. Oh, we are starting this. This is going to be impactful. But go back to it. They are no longer they are no longer effective. They are no longer in existence. So we need to ensure that there is sustainability in every program that we're carrying out, with government, with NGOs, with CSOs, with CBOs, especially CBOs, because most of CBOs, which are community-based organizations, they are mostly underrated. People don't really rate them that, and they are the ones that work closely with the grassroots. These people that we really want to talk about. But when it comes to all this political establishment, then we remember the grassroots, that these are the people that we need to go to get their votes, to get their agreement. So I think we really have a long way to go when it comes to government and CSOs
collaboration. Yes, of course. I mean, if we want to look at it outside SRHR, if we look at a lot of issues, then you will definitely understand that there's a long way to go, and their efforts cannot be overemphasized, because as much as we need the government, we need them. Yes, because they get to reach places and touch bases with places that the government maybe it's in the next 3 years or 4 years the government will think of going there. But they must have actually, during elections, they get to go there and make all sort of promises. And after then, NEPA don't have lights. So let's try to see how we can manage our time so that we're able to cover a lot of things here. Now let's look at steps that can be taken to improve the implementation and quality of comprehensive sexual education in Nigerian schools and communities. Because earlier, Simi mentioned how we can get representatives from each school to come together, bring up some of these policies that will help them and then take it further from there. So now, how do we get to improve the implementation of the quality of comprehensive sexual education in Nigerian schools and communities? Because if they're not well educated, for them to know that I have rights when it comes to sexual health, and if I don't know, then even if you come to choose me to be part of the the people that will talk, I wouldn't even know what to say, because as far as I'm concerned, my mother must not hear that I'm in this kind of group. So I don't want to get involved. So but if they have the education, their minds are open and they're able to go further to ask questions. So how do we involve this into schools and communities?
Okay, thank you very much. To inculcate sexuality, enlightenment, and education into our curriculum, it is very important for us to do a curriculum reform that inculcates this form of lesson into our educational system. And this will not be easy, because some private schools have tried on their own volition to enlighten these young people, to teach them information about their private body and all of that. But the parents are always very resentful, and which is very understandable. Now, the thing is, you are telling us that, you want to start teaching our children sex education and all of that. There are a lot of parents who feel like maybe a male teacher is taking my female daughter. This might be a way of this teacher getting involved. We have a lot of pedophiles and everything.
Of course, you can never be too careful.
We need to also have this community engagement, that we are trying as much as possible what we are putting into the curriculum. It's not like we are teaching a child in kindergarten reproduction. It is very inappropriate for the age. So we need to also have this community engagement with the parents, that at different levels, these are the kind of information we want to pass across to these children to help them. Then we also need to train the teachers too. The teachers need to know which one to do and which one not to do.
How far
because a lot of people don't even understand the whole essence of sex education, or what it entails, or how you can inculcate this into the education system and all of that. So aside curriculum reform, we need to do teachers training, we need to do community engagement, we also need to have youth-friendly teaching methods. We also need to teach these teachers how to tell them, maybe in primary 1 you have to tell them, this is my private part, you cannot touch my private part. Anybody that tells me that I should not tell my mom is my enemy. This kind of thing. The children will not forget. You can even formulate a song that help them remember and tell their parents if these things are happening. Then one thing that is very, very important, evaluation and monitoring. Because before the whole thing gets out of hand and they will say, it's a society organization that's encouraging this thing now. Now they're sleeping with the students in class, teaching them that is sex education. It is very important that we evaluate, how far this is going, what we are teaching them, how this is impactful, and also monitor the things that are being taught to the students, which is very, very important. So this will really help us to inculcate it into our system and make sure that we are actually giving them the education that is age appropriate.
Definitely. All right, do you want to add something?
Yeah, just quick.
Go ahead.
Okay. So I really appreciate your points where you talked about, using like a form of song for this. Yeah, I think I recently heard that in private schools now they are teaching them songs about if you touch my body. Songs like there are places that if you touch, then they tend to let you know that you are going wrong. So I think that is really, really important. And there's something that Vision Spring Initiative does. There's this program we do in secondary schools, junior schools, where we teach them about their rights. But the entry we do is we want to teach these girls about their bodies, their rights, how to say no consent and all that, bodily autonomy. So but when it comes to the teaching, we let them know this is what we are actually talking about, and we do not, just like what she said, we engage the parents. We let them understand that your children are going to undertake this particular education, so that you don't get your daughter doesn't get home and start saying, that is what it's because of what they taught you, and now so you are doing this to me, you are doing that to me. Because we have to ensure that for you to pass the information to these children, if you are not involving their parents, you are making a very huge mistake. You have to let them know. And also the teachers that are going to be involved in that education, they must be trained. So you can't assume that this person has this knowledge. It's a lie. They don't have the knowledge. You have to train them. You have to engage them. And there's something about anonymous reporting. We call it a Pandora box that only the girls can access. Only the students can access it. They put questions about their bodies, maybe whatever has happened to them. And we get a lot of discoveries that we would think that this could never happen to somebody in this particular class, like maybe molestation by their father, parents, uncles, that they can't even tell their teachers, they can't tell their mom. There was even one that said she has gone to her mom, and the mom was like, my husband can never do that. How can you dismiss your daughter over what happened and you're saying your husband can never do that? So you imagine that kind of cases. That is when we come in and we take up these questions and we treat it, and we take it to the necessary, like Lagos, the DSVA, we work with them and we treat these issues. Because if you are talking about the CSE was introduced in 2001, and all these conservative groups, they went against it because it was so elaborate, it was so comprehensive, and they were like, no, let's just streamline it to abstinence. Because, okay, I can abstain, but can I abstain from being raped? Am I the one that raped myself? So we have to do things that we have to think outside the box. Okay, it's fine for me, I can abstain, but what if you get to a stage where I don't have power over what is happening to me? What happens then? Is that the end of the case? So that's it.
Wahala. All right, so this is where we will wrap the program up today. I just wish that we had more time to talk about this, but we have actually touched about a lot of issues right here, and I'm glad that you actually talked about age appropriate education, sexual education. So just before we go, Simi, just give us a few words, your final words and all of what we've talked about today. What's the important thing that you would want our dear listener to take home from this conversation today?
Okay, thank you very much. The reason why ASE is having this kind of dialogue is for us to be able to bridge this gap between sexual reproductive health and getting to adolescent and young persons. Now, one thing that I want people, or the things that I want people to also know, is that there is no us without us. You cannot innovate ideas, you cannot get us involved, or you cannot do things that favor we young people without us. Then another thing is, this is something that involves everybody, community leaders, religious leaders. Let's stop making this like we are waging war against religious or morality. Let's try to inculcate this and see how even religious and religion and morality teaches us about sex in a way, but the only thing they teach is abstinence. So there's a way we can actually strike a balance in educating and also getting these community leaders involved, so that we can all achieve our aim. So this is a discreet call for everybody to take ownership of this, so that at the end of the day we can all achieve our aim. Thank you very much.
All right, Anu, in less than a minute, quickly, let's have your final word.
So there's a common saying, Toba Shewo, if it were you. So we have to ensure that whenever or whatever is happening around us, it concerns us. We should not dismiss it. Oh, it's not my daughter. Oh, it's not my son. It does not concern me. It's not my family. We have to ensure that there is community collaboration. Everybody, each one teach one, each one raise one. We have to ensure that there is this leveled education, awareness amongst everybody. You've heard about this. You are listening to this radio. The next thing for you is to take it home. Tell people that are not educated. Tell people that are not aware about this information that you have gotten today. Pass it to them. Let everybody know what is going on, because when it comes to you, you will know what to do. So, but we don't want it to reach. We don't want it to reach your turn now before you take the initiative. So we are urging all of us to ensure that we are our neighbors' keepers. Thank you.
Thank you so much, Annie, for that. And I must thank both of you for coming through, and thank Hisi too for this important conversation that we have had today. This is Women Radio, and of course, you know that conversations like this does not end here. We'll have to keep talking about it. For us here at Women Radio, it's something that we keep talking about, over and over again until we see the change that we need. That change, it must come.
Yes.
And we'll definitely keep working towards it. So thank you so much for coming through. And thank you too for tuning in and listening to this special big question that we had to come up with today. We had Anu Luapo or Osheni. We also had Simi Luluawe. Thank you so much, both of you.
You're welcome.
My name is Rose Yusuf Kaiser. Do well to keep your dial locked right here on Women Radio WFM 91.7. Good afternoon.
For wholesome music, it's up your day. Stay tuned to WFM 91.7.